Hi and welcome to this talk about treatment of pain, and more specifically treatment of pain and emotion, and why it is important to understand the difference of treating an acute pain and a chronic pain, and why the emotions are involved in this. So I am Godthjaelp from Godthjaelp Institute.
I am Stéphane Maugendre from Godthjaelp Foundation in Paris and Godthjaelp Institute too. And we will talk about specifically about emotion and the relation between emotion and pain.
So, Stéphane, I will ask you, why is it so important? What is the main thing you have to be aware of when it's about pain and emotion?
Emotion is a big part in your life, and if you have a bad emotion, you will increase your pain. So it's very important to understand that it's not natural when you get a chronic pain.
So does this pain, this emotion, is it always related directly to the pain, or can it be any emotion that you have that will increase the pain you have?
Yes, it's more complex. It's a part of pain because we have several kind of pains. The emotional part can be, sometimes it's the front of the scene and sometimes it's backside. So it depends.
What does that mean, front of the thing and backside?
Sometimes we have pain, it's due to your emotion. So you have to fix your emotion, your bad emotion.
You have to work on your emotion.
You have to work on your
Yes.
emotion to decrease your chronic pain. And sometimes it's a secondary.
The other way around. So you have you have emotional difficulties because of the pain.
Yes, it's a consequences and it's a cause in another case.
But could it also be, let's say that I have a chronic pain and I'm depressed because I lost my work. So this will also increase my pain, even though those two things are not related.
Yes, it's a part of your life. It's a complex, it's a global approach. You have to take care about biological factors. You have to take care about social factors and emotional factors. It's psychological factors. So it's a global approach when you get a chronic situation, and you have to deal with that. Yes.
Okay, so let's take one thing at a time. So try and tell me in short ways, when I have an emotional problem and I get pain, then how would I think about that in ways of treatment?
The way of the treatment, for example, it will be like we made for our study. We will use color and frequencies for traumatical image, for example, because it's linked with a bad emotion and an event.
Yes, exactly. When we work with the emotional traumas, we tend to use more colors. You can also use colors when you want to treat physical pain, or of course it's physical, but a pain because you fell or broke your leg. But very often when you work with the emotions, we tend to use the colors or the frequencies or the electricity.
We can do that. In fact, after you have the perception of pain due to your emotion, you have a different expression of this. And after, we will try to understand what kind of action you will take with it.
Tell us more about the action you will take.
Action, it's, for example, communication. When you get a chronic pain, you have the possibility, or it's your responsibility, to share with your family, your boss, your friends, to share your pain. And when you have some discussion about that, sometimes you understand more because other people experienced pain, and they will give for you feedback about their pain and how they treat it, for example.
So communicating to people around you that you're close with about your pain is important, because when you speak with other people, then you will have like an exchange of notion of what you could do about it, and also just speaking about it, I think, would also be a therapeutic.
Yes, and you don't stay alone with your questions.
The loneliness, it's also a pain factor.
But in other situations, it can be worse because your family can be judge you.
They can judge you.
It can judge you because I want an alternative medicine. I don't want medicines
or approach. Operation or
yes. But sometimes you have the choice but your family can put a pressure on you. So sometimes it's very
or
good to
friend
communicate.
or
Friend.
or
Yes.
somebody. Yeah.
So it depends with the action of pain. So it's nice to understand you have the perception of pain with your emotion, you have the expression after of that, and after you have the action with them.
Okay, so I would like to now go back, because now we're getting deep. And right now it's just a short talk. So let's just go back, because now we just talked about having an emotional problem and then getting pain. So now let's say that we get a pain from falling off our bike or being in a car accident or cutting something off when we are with a knife or cutting cucumber, whatever.
It's a lesion pain. It's a
lesional pain.
So there is a damaged tissue. So there is a big inflammation in your body, and so you understand there is a afferences or neural afferences. So it's a message from your neurons to your cortex, and you feel the pain due to that.
So the nervous system gives information. So I for some reason cut my finger, chop it here, and I get information through the neurons to my brain, to the cortex, telling me there is a pain.
Right,
and I also have an inflammation because I had an object cutting into my finger, and also to repair, there will be an inflammation.
And it's a healing process to have inflammation. But
it's a healing process. And this is important because often when we talk about inflammation, we talk about it as a problem, but without it, we would die. So it's actually very good that if something happens, we get the inflammation, because it's a healing process.
Yes, it's a healing process. And after that, for example, some people get always pain, and it's not about a lesional pain, because you have no damage tissue after 1 month, for example, but you have some in your memory. You can have an emotional of your knife. You cut your fingers.
Yes, or the car driving into you,
and after you feel chronic pain due to, but it's another kind of pain.
And then we're back to the chronic pain situation where the emotions have more space, and you need to look more towards the emotions regarding the pain. So when we treat lesional pain because we're talking about auriculotherapy, and I don't think we said this in the beginning, I will write it in the text. So when we're working with auriculotherapy and we're talking about lesional pain, how is the approach to treatment then? Because what?
The approach of this, it's very simple. In acute situation, follow the map. Follow your education about that. It's simple. It's logical. You have to follow the neurological pathway.
So when you say follow the map, it means if you have a problem in your shoulder, you go to the area of the shoulder. If you have a problem in your elbow, you go to the area of your elbow. If you have a problem in your hip, you go to the area of your hip, and so forward. So you follow the map of the child in the ear, and you treat that.
But in chronic situations, the neural networks will change. And the awards loop, for example, your emotional loop of the neural networks about that will take large parts in the pain. So it will activate some cerebral structure, limbic or emotional structure in your brain, and it changes a lot the expression on the ear.
But when we have the acute pain, when we have the a lesion and acute pain, you go to the map. And what kind of treatment do we use? We use needles, TCM needles.
Exactly.
Electricity.
Yes. For example, you have to search which organs it's involved, and you can put a TCM needle for 20 and maybe sometimes 30 minutes, or ASP. You can, in this case, treat with electricity the orthosympathetic nucleus of the area of the lesion pain, and you can use border point and master point, but it's auriculo advanced.
Yes, that's advanced. So, but also when you want to find the points, of course, you will use VAS, but you will very often use the blue pressure point finder.
Yes, the VAS is not a good tool to search a pain. It's easier and logical to use your blue palper.
Yeah. So last kind of pain I just want to talk about that we also approached here is, let's say that I'm in a state of depression or big stress because I've just been fired, or something big happened in my life that made me sad. So I'm already struggling with sadness or depression or stress or something, anxiety, and then I fall on my bike and I have a pain. Then what will I do in this situation? What is the approach in this situation?
For example, in this
situation.
situation.
And why pineal gland?
Pineal gland?
Yes, why?
Why panaglon? Because panaglon is involved in depression. It's a hormone organ who regulates your cycles for mood. Sorry,
Not for the moon,
not
but
for the mood, for the mood.
But also for the moon, if it's about
yes,
menstrual cycle.
Because it always cycles. So
it's all cycles around
periods,
yes.
women, and for sleeping disorder, and
yes,
and
night workers, night shift workers, and so on.
And thermoregulation of all your organs.
Yeah. So what you're saying actually also is that if you have a problem before you get the pain, it's very important to look at the stress that's already in the body before you have your accident or your physical lesion. So before you, let's say that there is a major stress in your life and you cut your finger or you go to a car accident. So then we are at the acute. So if I have a problem in my hip, I will go to my hip because it's acute. But for it to heal faster, I also have to relate to the emotional state that I'm in when I am in the accident, because this will have an effect on the treatment, no?
Yes, and that's why you need...
And the pain.
And the pain, and that's why you need more sessions. You need 3-5 sessions or more to get a healing treatment, a complete treatment, a global approach of your treatment.
Because this is the global approach.
Because it's a global approach.
Because it's a global approach. All right, we will stop for now.
Yes.
And thank you for tuning in and listening. We are Dr. Stéphane Maugendre, and I'm Rikke Godthjaelp.
You can visit the site.
Yes, and Godthjaelp.com actually. Yes. Yes. And if you have any questions, you can drop a comment here, or you can write to us, and you will find all the information here or here or here. You can also join our courses. Yeah. If you're interested and find our material online, go to our homepage and you'll find everything there. We have a page for courses in English, and we have a page for courses in Danish.
Have a nice day.
Have a nice day.